Today we are going to be looking at whole body CT screening. This is group 28 with the group members Diana Majid, Lynn Lee, Neha Joshi and Justina Hanna. So in today's presentation we'll be looking at what is whole body CT screening, why is it important, the beneficial and limited use of CT screening, and to answer the main question, should whole body CT scanning be performed on asymptomatic patients? So what is whole body CT scanning? To start off, CT or computer tomography is a device that is used to scan for any signs of abnormality within the body. The patient is passed through the CT scanner as a cross-section of the body is captured. The CT scan contains two major components: the X-ray source emits X-ray into the body, and the detectors that capture the X-ray passing through the patient's body. The X-ray source and the detectors move in a rotational motion when the detectors remain aligned with the X-ray source. This rotational motion enables the CT scanner to capture many cross-sections of the body at many different angles. Once this process is done, the images are collected, reconstructed, and displayed on a computer for examination. So what makes CT scanners an important device for imaging? Well, it is able to identify infections and cancer, especially the early stages of cancer. By detecting this, it's easier to manage and prevent the growth of cancerous cells. It is also used to determine the effectiveness of a certain treatment and thus monitoring the progress of a disease. Also, the image collected shows great detail of soft tissue, organs, and bones, unlike the normal X-ray that only shows the projection of the body.
Over the past few decades, there has been a common issue with patients experiencing the CT scan during procedure is the exposure to radiation. There are both pros and cons to concern for this diagnostic test. Commonly, a CT scan is most effective in diagnosing a specific disease or abnormality in patients who have symptoms. Other advantages of CT scan is that a whole body scans are performed on diseases that have high potential in developing rapidly over time. Performing this enables progressive monitorization. Furthermore, cancers that are detected early can be removed or treated early, which may increase the patient's survival rate. Computed tomography enables the diagnosis of types of cancers. Also, it enables detailed imaging of soft tissue and bones. And finally, it is painless and non-invasive, which almost safe procedure that does not need any recovery time.
So far, it may seem like a good and simple idea to undergo a full-body CT scan to screen for cancer in its early stages before symptoms have appeared. Patients may have the misconception that if cancer is detected early using this method, then it will be easier to treat it in its early stages before it advances. However, the cons outweigh the benefits. Firstly, not all abnormalities detected denote a serious malignant disease. The results may give a false positive or a false negative result. This would lead to the patient requiring further scans and tests to confirm the abnormality. This exposes the patient to unnecessary amounts of radiation, which may possibly damage the patient's cells and increase the patient's chances of developing cancer in the future. If a disease is caused by radiation, whole-body CT screening would only promote its growth instead of controlling or preventing it. A single full-body CT scan can expose a person to 12 millisieverts of radiation. This amount of radiation is close to the 20 millisieverts that survivors of the Japan atomic bomb were exposed to. The survivors faced debilitating health effects and very high rates of cancer. It's been stated that the test most suitable to detect a particular disease, such as a pap smear for cervical cancer, is a more useful and beneficial way to diagnose cancer than whole-body CT screening.
Though there are many advantages and benefits of whole body CT, there are many limitations to using it for detection of cancer. Whole body CT cannot replace cerebrospinal fluid examination that is used for detecting brain tumors. If the lesions in the body are too small, it becomes difficult to locate them. It's difficult for radiologists to detect cancer in a full body scan because they don't exactly know what they are looking for and what area of the body an abnormality may be. This leads to false negative or false positive results. It gives no histologic information about the tissue, hence not providing information whether the tumor is malignant or benign. It cannot be used on pregnant women as the ionization radiation in CT may damage the DNA of fetus. Lastly, the procedure is very expensive and may still not provide perfect results.